What the first human bird flu case without animal contact means for us all in a startling development. A Missouri resident recently tested positive for bird flu, despite having no known exposure to infected animals. This marks a significant shift in how we understand and manage the virus, raising urgent questions about the potential for human-to-human transmission. Could this be the start of a new chapter in the fight against infectious diseases? As the world watches closely, it's time to unpack the implications of this case and explore what it means for our collective health. The unexpected case that shook the experts, a virus without a clear source. The recent case of bird flu in Missouri has baffled experts. Unlike previous cases where individuals contracted the virus through direct contact with infected poultry or livestock, this patient had no known exposure to sick animals. This raises a critical question: how did they get infected? The Centers for Disease Control and Prevention, CDC, is currently investigating this mystery, and the implications are profound. If the virus can spread without animal contact, it may indicate a shift towards human-to-human transmission, a scenario that could dramatically change the public health landscape. Tracing the virus's path, a closer look at the virus's journey to understand the potential risks. Scientists are tracing the genetic makeup of the virus found in the Missouri patient. By comparing it to strains from other infected individuals and animals, they hope to determine whether it's the same virus that has been circulating or a new variant altogether. This detective work is crucial. If the virus has mutated to spread more easily among humans, we could be facing a much greater threat than previously anticipated. On the other hand, if it's the same strain, the focus will shift to how this person contracted it without animal contact, a mystery that must be solved to prevent further cases. The human toll of H5N1. Understanding the severity of bird flu, or H5N1, is not new, but its impact on humans has been severe, with a mortality rate of about 50% in those infected globally. Fortunately, the virus has struggled to spread easily between humans. Most cases have been limited to those in close contact with infected birds. However, the Missouri case is a sobering reminder that the virus is unpredictable. Public health experts warn that even though the current risk to the general population is considered low, the virus's ability to mutate and adapt poses a constant threat. Could a backyard bird feeder be the culprit? Exploring possible sources of infection. One theory that has emerged is that the Missouri patient might have contracted the virus from an indirect source, such as a backyard bird feeder. During late summer, many birds migrate, potentially carrying the virus with them. Michael Osterholm, director of the Center for Infectious Disease Research and Policy at the University of Minnesota, suggests that contact with a feeder used by infected birds could explain the case. This idea highlights the need for increased vigilance, even in everyday activities that might seem harmless. The possibility that a simple interaction with a bird feeder could lead to such a serious infection is a reminder of the hidden risks in our environment. The urgent call for preparedness. Preparing for what comes next. The Missouri bird flu case serves as a wake-up call. While the CDC maintains that the risk to the general public remains low, experts like Dr. Jesse Goodman from Georgetown University argue that now is the time to prepare for a potential outbreak. In a recent opinion piece, Goodman emphasized the need for more investment in public health infrastructure, including the development of vaccines tailored to combat bird flu. The lesson from past pandemics is clear: waiting until a virus is spreading rapidly is too late. By acting now, we can mitigate the risk and be better equipped to handle any future threats. The importance of staying informed and vigilant. As we continue to learn more about the Missouri bird flu case, it's important to stay informed and vigilant. This case could be an isolated incident, or it could be the first sign of a new public health challenge. Either way, it underscores the importance of preparedness and the need for continued surveillance and research. The CDC and other public health agencies are on high alert, but we must all play our part by staying informed and taking necessary precautions. If you found this article insightful, Please share it with your friends and family. Don't forget to like, subscribe, and leave a comment below to share your thoughts or ask any questions. Together, we can stay ahead of the curve and protect our communities from emerging threats like bird flu.